So there are a number of celebrities that we all look towards who have got the perfect kind of fox eye look. So Bella Hadid is someone that's got a great angle within the lateral side of the brow. So the side of the brow is a little bit more raised. It results in more of a kind of open look and positive look to the eye. Also, Hailey Bieber's got a really attractive side of the eye too as well. So this is something that everyone's trying to achieve, even through non-medical ways as well. So makeup can really achieve this look where you look to really raising the side of the eye. So the bit that we're really actually talking about is not so much the eyebrow, it's something called the lateral canthus. This is the area just on the side of this of the eye, so right in the corner. Normally, if you draw a little vector from the side of the eye and see whether it's actually the lid is going down or neutral or up, that will tell us whether you can actually benefit from it. So if it's a bit more neutral, it's coming down, then you may benefit from a little lifting of that area. Obviously, you don't want to go too far because you can look a little bit cat-like, and that's not the aim you want to be doing. And we're going to be going over some of the pitfalls through actually cosmetic surgery that you do not want to go down when you're trying to achieve this look. So like with anything in Nip Talk, we're going to go from like non-surgical to more surgical ways of achieving this look. So the most easiest way of doing this is with anti-wrinkle injections. So things like Botox in this area can really achieve quite a nice look. So if you can see, I haven't had any Botox for about 8-9 months or so, and I've got full movement back in between my brows. You can see that my eyebrows come down, particularly around the sides as well, as you can see. And we'll show this a little bit later on. If you relax these muscles, it does the opposite. So if you want the side of the brow to come up and the middle of the brow to come up a little bit, you can achieve this with Botox. You must have an assessment with a doctor first, because they'll be able to tell you what sort of a look you can get. If you've got heavy lids, then maybe you might not get so much of an effect from Botox injections in this area. Secondly, something that's really unknown is a really nice way to sometimes even combine with Botox injection is also filler injection in the area. So guess what? Filler can lift. So if you inject it even around the brow area, so if you can see on me, as you may have seen on some of our other videos, I talked about how I've got a hollowing above the brow. If you fill this area, it will lift the brow, and also the temple region also acts to lift the side of the brow too. I do some specialized injections deep down on bone around this area in a fat pad in this area called the roof, which actually acts to open out the eye as well. So there are some advanced filler injections that you can use to gently give this a little bit more of a raised look. If you combine it with Botox, you may even get even more of a look. So these two really relatively simple non-surgical options can really give you a nice kind of fox eye approach. The next thing that you may have seen all over social media and is really popular on Instagram are all these threads that we put in the side of the eyes. So I've been doing this for a number of years, but now I'm seeing a lot more traction on these posts. So what happens is that you can inject a number and insert a number of different types of threads within this area. Most of them are dissolvable and they're made of the same material that we use in stitches. So they're available as either PDO threads or PLLA threads, which have a little bit more of a longer last. So PDO threads tend to last anywhere between like 9 to 12 months. PLLA threads can even last up to 2 years. And this we can inject and insert around this region and fixate it to the hairline, and it gives you a little bit more of a lift. We place them in strategic areas just on the side of the eyes, and they anchor just into the hairline over here, and it acts to lift this area and it gives you a little bit more structure and support. So if you've already injected maybe a little bit of filler to make sure that the planes are nice and straight, and then you go and put some threads in there, you can get even more of an exaggerated look. Do not fall for what's on Instagram where you see things like this. This is not a great look, and no patient should ever be left like this post a thread lift in placement. One of the things that I always say is even when it's like this afterwards, it does come down. So this is not the end effect. I always say when you do something, always do something that's reversible. And using absorbable threads that dissolve over time initially is a really good idea to see whether you like it. That brings me on to the next way that we do fox eye lifts. I can use actually sometimes permanent stitches to actually lift the brow up. And that's something that we do normally after a little bit of a trial run with maybe the PDO threads and the PLA threads. We place this permanent suture and then also stitch it back into the scalp. it stays there for basically ever, and also gives you that nice kind of lift within that region. It's something that really is quite a great alternative, because the more invasive way that has been left, and we're going to talk about in a bit, involves cutting, and that's what some people do not want. So if you've decided to go down the permanent look, and then you say, well, I really do like this and I really want to maintain this, then your PDO threads and PLA threads should be probably done every 12 months, every 12 to 15 months. You might not need as much inserted in one go. You might just need what we call like top-up treatments. The permanent threads last a lot longer, 2 or 3 years. And then that brings me on to kind of surgical brow lifts. So you can have a small incision just into the hairline and lift the brow surgically. So this is more for patients with kind of more advanced aging, more heavier areas on the lids. They may require surgery just in the skin and in this area to aid that little lift in there as well. And there's also now some endoscopic brow lifts, which is almost like keyhole surgery through the scalp, which again, it's got a more degree of permanency, slightly more increased risk of complications, but it will give you a little bit more permanency to the results.